and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Our opinion is the only one that matters.
Absolutely.
Today, Brad, we're going to talk about 1-minute back pain exercises for quick pain relief and cure. This is going to help probably about 80% of the population out there. It's not going to help the people with spinal stenosis or your problem, spondylolisthesis. But it's going to help most of the other people. So let's get started, Brad.
And there's 10 of them. Not all of them are going to work, but you're going to find out there's going to be a few of them that are going to work really well and some may not.
10, 11, don't count. We're not sure how many we're going to get to today.
Okay.
So let's start off with the standard one, Brad. This is the one that everybody should be trying first. Why did we make such a mess before we started?
I don't know, Bob.
All right, I want you to do some type of press up. And so what you're going to do is, without me laying on my mic, you're going to start by laying on your stomach here. You might even prop up on your elbows a little bit.
Sure.
You might just lay here for a little bit. But if it feels okay, you can do this within a minute. You can just lay down and you can go ahead and put your hands underneath your shoulders and start pressing up like this. Now the key is that you don't want to bring on pain.
Right.
So if you have pain, just go up to the point where you start to feel the pain and then back off a little bit and eventually work your way up further and further.
Right. One red flag, like Bob says, if it gets worse, or if by some chance you start getting pain, numbness, tingling down one of the legs, that'd be another red flag. You'd want to stop doing it then.
And you can do variations of this too, Brad.
Right.
You can shift your butt over to the, let's say if the pain is on this side, you want to shift your butt over away from it and then try a few press-ups.
Right, so you're going to put a little crookedness in your body.
Yeah, a little banana is what we call it, because you're kind of forming a banana.
If you're looking from the top down, you're putting an arch in your back sideways.
If that doesn't work, shift your hips over the other way and try press-ups.
Right.
I mean, you got to find out what works for you, Brad.
Right. You got to work with your body a little bit and just follow the rules. If it doesn't create pain, feels better, you continue with it.
Yeah, Brad, as I look out there, there's some new people watching us today.
Oh, yeah, that's right.
So in case you are new to us, please take a second to subscribe to us. Our subscribe button's over here on the left side of Brad, your right. We provide videos on how to stay healthy, fit, pain-free, and we upload every day.
Good.
Next one, Brad. This is a nice one to do because you can do it throughout the day, is standing extensions.
Sure.
So very simple. And again, it has to be pain-free. Sorry, Lonnie, I just stood up. She hates that because I'm so tall.
That's it.
Put your hand on your butt, or a little bit, right around the waist. Some people like to put the two fingers like on the belt line. Mm-hmm. And you're going to do the same thing, kind of some press backs here.
Yep. Why don't you turn that way once, Bob?
Oh, sure.
So, like Bob has his thumbs right there. Sometimes people put their fingers in like that. Whatever feels right for you.
Fists.
Yep.
I mean, you can do a lot of different variations. You can also use a belt.
Oh, yeah.
So you just keep a belt lying around. Well, thanks, Brad, for
Just
putting a knot in it.
I could have never done that if I tried.
So you can, this is just an easier way to do it. You can go ahead and, without hitting my mic, you can go ahead and pull back like this.
Right.
Now, there's variations of this, too, which we were going to go a little bit later, but I was going to talk more about the mid-back.
Oh, sure, yep. So. We'll get into that.
Okay, Brad, you're going to show a standing extension with a countertop. This works out really well with a lot of people that I have So a lot of people that are elderly really like this one.
So if we're doing the extension backwards, and you've got someone that may have a balance problem, whether they're older, they have vertigo issues or something like that, and you're afraid they're going to fall backwards, go up against the countertop so they're just touching it, and do the same thing with your hands like we talked about. And then if they do lose their balance, they catch themselves.
And some people even brace against the countertop and gives the counter force.
Yeah, here we got something right here. I'll bump my head into it.
See how I said that? Counter force. I get the countertop gives counter force.
I was a little slow.
Yeah, you were.
They're laughing like crazy out there at you.
So let's go a little bit more now. That was more low back. Let's go a couple with the mid back.
Sure. Mm-hmm.
One of them is just you're going to take your fist like this, and you're going to go ahead and you're going to go and back like this, and you're going to push in and up a little bit.
Right.
And you can work your way up and down the spine on this, and you can even go off to the side too, Brad. Different spots here. This is amazing how much this feels good. I know you've done this one.
Oh yeah, I do that one on a regular basis.
Yeah.
Yep.
So can you see?
I can see. I think they had a good view of that, Bob. But yeah, and again, you'll find the spot that feels good and work that spot.
You can also do it with a belt, Brad. You can do that same one where you work your way up and down the spine. Now this is a little different in that you're going to put your around you like this, and your arms are at a 90-degree angle.
Yep, right here.
And then I'm going to pull up like this.
So the force is going
Yeah.
at an angle, kind of upwards.
Right. And now I can work going back, and I can even work going forward too, Brad.
Sure.
If you find the right spot, it's almost like you're giving yourself a little bit of self-mobilization
Sure.
here.
Yep.
Works out really nice.
Let's turn that way so they can see. Yeah, there we go. So you can see we're up into the low thoracic spine, upper lumbar. It's right in that midpoint, which can be a source where there's a lot of pain and problems that need some work.
That's a good tip, and all you have to do is have a belt around.
Right.
So.
Yep, exactly.
All right, where are we at, Brad? How about Cat-camel?
Oh, yes.
We never know what the camel is and which one the cat is.
You know, we get comments from people that correct us, and I got to jot it down so I can remember.
One of them's the camel.
Yep.
You think it's camel? It's got a hump.
Yeah, that's humping up.
And the cat.
Right. And then you're going to arch
But I've
through
seen
that.
cats do this too. I've seen Halloween cats.
Well, regardless, Bob, let's talk about the back. Here, go arch downwards. Your shirt's puffing up. We got to get some sports.
I got a puffy
Sweater.
shirt.
There we go, right there, arching down. And again, this should feel like a good stretch. If you go one way, let's say you go up, go the up.
Yep.
And if it starts to hurt or create some pain, then you're not going to go into that. You're just going to go till you starts to get the pain, and then go the other
Right,
direction.
go in the direction that's going to serve you best.
Right. Work the pain-free range, and with luck, it should improve. So you go back to full range.
Now this one, Brad, is called the lion. This
Okay.
next one here. So you put your knees apart, a little wider than your shoulders.
Yep.
And you're going to put your hands out like this.
Yep.
And you're going to stretch back like this. Now, if that hurts, there's a lot of variations you can do with this.
Okay.
Let's say there's pain on this side. One thing you can try is put the hand and that leg a little closer together and come down like this.
So what Bob said, if the pain's on the right side of the low back, maybe the right buttock area, bring the right knee up and the right hand back.
Another variation, Brad, thank you. Could you give me the towel, please? Is you could put a towel underneath the painful side and then try it.
So it's going to shift the pelvis a little bit, putting a little different stretch on the back.
Another thing, Brad, I'm giving you a lot of variations here, but you can actually arch this way and go down and try it.
Yep.
Or arch the other way and go down and try it.
Right.
All these little variations, find which one works for you.
Right.
Because it's a way of getting movement in the back, and it's a way of getting things moving. And if there's anything we've learned about back pain, Brad, the more you can get things moving, the better it's going to do.
Right.
Right?
It's just a matter of finding the right movements that make it feel better and not the ones that irritate it. If your back is flared up, that particular exercise you may not be ready for if you're
Right.
in pretty acute pain.
Yeah. Try which one. Do you want to do rotations, Brad? Just simple trunk rotations, you know.
This one, however, if your back is in pretty rough shape and you're not moving too much, this one you probably will tolerate.
You want a pillow, Brad?
Yeah, I'll take a pillow.
What a nice guy I am.
Thank you,
Okay.
Bob. All right, here we go. So I call this hook line position, feet here, knees up, and knees and feet gently together. You're not squeezing them, and then you're just going to gently rotate right to left. Now you might find that going to the right, hurts the back, so you just work it more to the left, go to the right until you start to feel it, and then work to the left. And then with time, you'll start to get more range of motion back and forth. Again, just trying to get that range of motion, circulation, movement in the low back.
Eventually, you could go to a full stretch, couldn't you, Brad?
Oh,
You could
right.
take it all
You
the way
bet.
down.
Yep, that's the goal.
Even hook the leg behind the other, this one behind, like this, and really
Yeah.
take her down.
There you go.
You know?
Sometimes I'll do
I'll
this.
do that.
Sometimes,
Yep,
either way.
exactly. Yep.
But we can't go this way because the cupboard's in the way, Bob.
Yep.
So we're stuck that way.
We have a counterforce.
Oh, Bob, you're killing me.
All right. This would involve a purchase. We got two of them, different ones here. We have the back knobber and the Theracane. And I really like these, Brad. I mean, this is my go-to thing when I'm having a little bit of back pain.
Sure.
I just love the pressure you can put on your back. You can do a lot of different things. One thing you can do, you can just do self-massage, Brad.
Right.
And that's what I often do. I just work all the way down the paraspinals here.
Yep.
And it just, I can just really work things. But the other thing
I
is,
believe it, Bob.
you can push off on the side of the back, and you can do rotations
yeah.
like this.
That's a nice one.
Yeah.
Now we're
And
getting into some real therapy.
different
some
movements.
Rotate.
Again, it's got to be pain-free, though.
And you can get in and really get some good, you get on that spot, I'm getting a lot of leverage with very little effort.
That's a good idea, Brad, actually. Be careful, though. Don't
Yeah,
be...
yeah, you got to be nice to yourself and use
Yeah.
good judgment.
Last one, Brad. Let's do a little traction. You've been doing a little bit of this one or not?
I do this one from a hanging position, but
that's right.
I do this one, I have done this one as well.
Get a couple good sturdy chairs. Not steady. Well, steady, too.
Yeah, something solid.
And you're going to go ahead and you can kind of lean forward like this and get up onto your toes, and you just kind of lean forward. And I'm still touching the ground, but I'm getting traction through the spine.
This one you really learn to have to know how to control your core muscles.
Sure.
Because if you relax them, you'll feel that back traction come through quite a bit. I do this one with a fair amount of patients that have symptoms down the leg. I got to be honest with you, the people who are not real active or have a lot of activity in the past have a hard time controlling their core muscles. So this works good for some people, others not.
And that's why we give you 10 exercises so you can pick which one may work for you and which one may not.
Exactly.
So, and remember, folks, Brad and I, maybe you don't know this, we can fix just about anything.
Right. But wait,
wait a minute, he's got his prop. It's already tore, it's already broke.
I know, but that's why we're trying to get it back together, Bob.
Broken heart. We can fix just about anything except a broken heart.
One of our viewers said Scotch tape, but I think we tried that. It didn't work real good.
Well, we'll keep working on it. Thanks a lot.